Center Maine is partnering with the Maine-Monitor to bring you some of the reporting being done by journalists at the nonprofit independent publication. We'll be featuring one of their stories each Monday. Today, we're taking a look at the Maine Department of Health and Human Services. When officials remove a child from a home due to concerns about abuse or neglect, the state must give the child a chance to visit with their parents or guardians in the next 7 days. Maine DHHS has contracts with 3 outside agencies to provide those visits, but one of them may be coming up short. Here to talk more about that is Josh Keefe with the Maine-Monitor. Thanks so much for coming in.
Thanks for having me, man. Appreciate it.
Of course, yeah. Okay, let's start with those visitations. What is supervised visitation and how does it fit into child protection?
So basically, it's a visit between a child that's just been removed from their home and their parents or guardian. The supervised part is the visits must be supervised because of the concerns about abuse or neglect that resulted in that removal in the first place. So somebody else has to be there. Sometimes it's a family member. Oftentimes it's a professional supervisor, somebody whose job it is to watch. And those visits are, everyone sort of in the child welfare space sort of agrees these visits are really important. You think about a parent who's had their child taken away by the state for whatever reason. They're going to want to see their child again most of the time. Those kids who've been removed, sometimes they end up with family members, but a lot of times they end up with strangers, foster or resource parents. They want to see their parents again. So, and in some cases, these are children, these are babies that are taken away at the hospital for concerns about substance abuse. So, forming that bond between parent and child is really necessary, and that's what these visits are all about. Most of these cases start with supervised visits, which somebody else is there. As they progress, there'll be lower levels of supervision. Eventually, they'll be unsupervised if the case progresses the way everyone wants it to. So the state has contracts for this because their own caseworkers kind of have enough to do already. And there's 3 regions in the state. Each has its own contractor. And the one we're looking at is called Community Care. And it has the contract for basically everything south and west of Penobscot County. And it has, in 2024, the data shows that it really came up short, meeting the terms of that contract.
How did it come up short and what did the contract actually require?
So the contract says that when DHHS makes a referral, that 90% of those referrals must result in a scheduled visit within 7 days. Community care scheduled visits within 7 days, 10% of the time. So they're supposed to do 90, they did 10. In Cumberland County, it was 3.5% of the time. So this is just in 2024. This is the only data we were able to get a hold of. We put in public records requests for this data. It took DHHS 6 months to get us this data. So yeah, and what happens is, according to DHHS and caseworkers, if the provider doesn't provide those visits within 7 days, they will still try to do that. So what happens is caseworkers who are already sort of overwhelmed with everything else have to then step up and try to arrange these visits when the contracted provider fails to do so.
Seems kind of pointless to even have the contract. So what did DHHS say about this and moving forward with this?
So Community Care did not respond to an interview request and a series of questions we sent them. DHHS said they were concerned about their providers not meeting their expectations. But this data was for 2024. At the end of 2024, in December, DHHS signed another contract with Community Care for about another year. So they might have concerns, but they also signed up for more time with Community Care as their provider in most of the state.
Other contracts, the other 2, how are they stacking up compared to this?
Better. AMHC is the organization that has the contract for Aroostook County and Down East. They were able to hit that 7-day window 45% of the time. So still not great, but better than Community Care. Penquis, which has a contract for Penobscot County and Piscataquis County. It's based in Bangor. They were able to do it. They scheduled those visits within 7 days, 93% of the time. So it can be done.
Is it because there are fewer people there, though? I mean, does population play into this, or? So
the amount of referrals, it's all kind of in the same ballpark. They're not noticeably more or less these different places. DHHS said that part of the reason that Penquis might have been able to perform better was because it was sort of a smaller geographic area and it was mostly mostly around Bangor. But Penquis did not really want to talk about. They said they were proud of the work they were doing. They wouldn't really explain why they were so much better than everywhere else. But yeah, I mean, I think it's an interesting question why some parts of the state were so much worse than others. The fact that Cumberland County had the lowest sort of might speak to the cost of living here and how much the state has to pay supervisors in order to staff.
Okay, so a lot to get into in this article.
Yeah, I'm probably oversimplifying it here a bit, but I appreciate the opportunity to talk about it.
Josh Keefe, thank you so much for coming in, and you can read the full story and much more at the-maine-monitor.org.